Thank you very much. Chair Sarah Fowler Arthur, Vice Chair Mike Odioso, and Ranking Member Sean Brennan, and members of the Education Committee. Thank you for the opportunity to provide proponent testimony for House Bill 485, which is known as the Baby Olivia Act. My name is Dr. Bill Lile. I am board certified in obstetrics and gynecology, licensed to practice medicine in multiple states, and I've delivered over 5,000 babies. I appreciate this opportunity to speak about patients' rights. Federal law and state laws protect the rights of all patients, including those who were not born in the United States. Yet we must also recognize and protect the rights of patients who were not born in the United States yet. Modern medicine allows us to diagnose, treat, transfuse, and even operate on patients in the womb. These are not theoretical possibilities. These are medical realities happening right here in Ohio. At the Cleveland Clinic, for example, physicians have performed life-saving blood transfusions and have recorded this on babies as early as 17 weeks. We have done this at my hospital and recorded it as early as 18 weeks. Well, why would a baby in the womb even need a blood transfusion, and why even record this? Because from the moment of conception, each baby is genetically unique from the mom, the dad, and the other 8 billion people on the planet. The blood type of a baby can even differ from that of its own mother. And there are cases where antibodies from the mom can cross the placenta and start to attack the baby's red blood cells, leading to a dangerously low fetal blood count that could be fatal. When this happens, doctors have two choices. They can either deliver the baby prematurely or perform intrauterine blood transfusions directly to the baby. Using ultrasound guidance, a needle is passed through the skin of the mother, through the wall of the uterus, and into the baby's umbilical vein and recorded on video. Donating O-negative blood is transfused directly into the baby's circulation, saving that baby's life, and this is a key in modern medicine. But modern medicine even goes further. Just 140 miles from here at the Cleveland Clinic, doctors performed open heart surgery for a baby while it was still inside of the mother's womb. This baby was diagnosed at 27 weeks with a condition called a cardiac teratoma, a heart tumor that was growing so rapidly that it would have been fatal within 1 to 2 weeks. The medical team decided with the parents that the best chance for survival was to operate on this baby before birth, and this was also recorded. The mother was given anesthesia, an incision was made in the abdomen of the mother and her uterus, and the baby's arms were gently delivered through that incision so that a pediatric anesthesiologist could actually place an IV in the baby's arm and administer fentanyl for pain control and Norcuron to prevent fetal movement during the surgery. The pediatric cardiothoracic surgeon then made an incision in the baby's chest, spread the rib cage, and removed the tumor from the baby's beating heart. Once the heart procedure was completed, the baby's chest and skin was closed, the IV was removed, the baby's hands were returned to the womb, and the uterus and mother's abdominal incisions were then closed. 10 weeks later, at 37 weeks gestation, that baby was delivered healthy and thriving. It's this kind of information that needs to be shared with our students under educational purposes here in the state of Ohio. The field of maternal fetal medicine continues to advance rapidly, often being supported financially by the state of Ohio's taxpayers. We are not only diagnosing and treating babies in the womb, we are now curing them. Often I'll say, a patient is a person, no matter how small. All patients deserve rights and recognition. The Baby Olivia educational video provides clear, scientific, and visually compelling evidence of fetal development and humanity. These babies in the womb are not abstract ideas. They are living, growing human beings, and they are patients, and all patients have rights. This video clearly provides education and insight into the science and medicine for these students and could motivate them to pursue careers in science and medicine. Thank you very much for your time. Chairman, Sarah Fowler Arthur, Vice Chair Mike Odioso, and Ranking Member Sean Brennan, and the other members of this committee for your time and consideration. I'm happy to answer any questions, and if somebody would like, we've even uploaded a 50-second video of that fetal open heart surgery.